on your hands and knees in the pool and the cord is really short, what happens next? So there's a fair few factors here. Cord avulsion, which is the cord snapping, is an increased risk in a water birth. The chance of the cord snapping in a land birth is 0.3 per every 100 births. So roughly about 3 in 1,000 births on average. In contrast, water birth is 1%. So 1 in 100 births will have a snapped cord. So it is an increased risk when you compare it to land births, but there are lots of things that your midwives can do to help reduce the chance of the cord snapping during a water birth. So firstly, we have a lovely little mirror that goes underneath the woman or person's bottom to be able to see that baby's head crowning, see when baby's going to come out. We keep mum's bum under the water just so that that temperature change isn't as big for the baby. So remembering that when the baby's head hits the cold air, it starts to stimulate reflexes to breathe. So we always keep mum's bum under the water just whilst the baby is being born. We would also encourage, if there was a student midwife, dad, mum herself picking baby up, is to do it really gently. So what a woman or person would naturally do is if they had a short cord on land, they would normally complain of pain and discomfort because their placenta is still attached to their uterus. And as that short cord comes up, it starts pulling on that and they can feel that dragging sensation in their uterus and they go, oh, that's really painful because the cord is so short that it means that their uterus is being pulled down with it whilst that placenta and cord is still attached to the baby. And so you would be listening to that woman or person to say, okay, right, we think we might have a short cord, so shall we just stand up and sit on the seat of the birthing pool, because there's always a seat in there. It might be that we help mum and baby up and then help get out the pool if there's a really short cord, for example. But it's listening to that woman, and that's why that slow birth of bringing baby up gently will enable us to give the woman or person time to understand if there is a short cord and they're feeling that uterus pulling down, because that's not a nice sensation to feel, and they will tell you if there's a short cord from experience. But it will also enable us that if we feel like there's tension on that cord, if we've done it slowly, okay, I think there might be a bit of a short cord, can we get you to stand up? And we will feel for that. But the woman or person bringing their baby up slowly and gently will give us that feedback, and that will help reduce the chance of cord avulsion. Now, if a cord avulsion, so a snapped cord, does happen, well, that's one of the reasons why we're looking at your baby immediately after birth, because if there's suddenly a little bit of blood loss, what we need to do as midwives is very quickly clamp if there has been a cord avulsion. I personally have never had one in my career, but I've certainly known of other people who have had one in a water birth situation. So the moment you have noticed that, fingers on, clamp, compress, put the clamp on as soon as it's possible. And usually with that as well, depending on how much blood loss, depending on how quickly it has been recognised, sometimes the paediatrician may come along just for a review, and sometimes there will be a full blood count just to check baby's iron levels, especially as delay cord clamping has not been able to happen in this case. But to summarise, it's a small increased chance of having a cord avulsion with a water birth. Water births are still really safe for both mums and babies. The chance of a cord avulsion and a snapped cord with a short cord or being in the water, for example, is really low. And the ways that we try to reduce it as midwives are to bring baby up really slowly when baby's being born, or asking you to bring your baby up really slowly. And if you start thinking that there's a dragging sensation, or if we can feel some tension on that cord, we would ask you to stand up or sit on the seat. And this here is an example of a birthing pool where there'll be a step that the mum can bring baby up to and sit on, and baby will be outside of the pool if there is a short cord too. The step is literally just in that lip here, but in other birthing pools it might be over here, for example.